Namaskar. Unfortunately, nowadays we hear people suffering from heart problems at the age of 30s and 40s. The signs that leads to heart disease can be observed in any age. It is important to take active steps if you notice some signs, and these signs very clearly tell you that your heart needs help. Today, let us find about the 7 signs that your heart shows to tell you that heart needs your attention. But be aware that these signs are not specific and may sometimes show up due to other health disease. If you are observing these 7 signs in long-term basis, or it occurring more frequently, or if you experience the combination of all these symptoms very often, then it could be the sign of underlying heart problem. First, tightness, pressure, pain in the area of chest is felt. You may have seen some films in that how a heart patient clutch their chest with their hands. They complain about tightness and pressure in the chest. This kind of pressure is also compared to an elephant sitting on one's chest. Heart condition usually appear as a discomfort in the chest. Chest pain could be caused by reduced blood flow to the heart. So if you experience pain, tightness or discomfort in the chest, you must take a medical help to find out the cause. Second, pain in the neck, jaw, throat, upper belly or back. You may know that this kind of pain is easily misunderstood as symptoms of other health issues. Perhaps in a teenager, these symptoms may not be taken seriously. Women should not ignore these symptoms, especially after menopause, because risk of heart disease increases after menopause. If a person complains regularly pain in the neck, jaw, throat, upper belly or back, then it should definitely be looked into. If it turns out to be because of something else, that is okay, great. Third, numbness in legs or arms. Now, this is a big indicator of heart disease. To be more specific, it indicates peripheral arterial disease in which the blood vessels become narrow and do not carry enough blood to the arms as well as legs. Many times, this numbness goes away on its own, but in many cases, it lasts for several hours and several days. The numb area may appear pale and may also become cold. So, whenever you observe such loss of sensation in your arms and legs repeatedly, you must take medical help immediately. Fourth, shortness of breath. This happens because when a person's heart begins to fail, blood pulls up in the veins, which carries oxygenated blood from lungs to heart. As the fluid accumulates in the lungs, it interferes with normal breathing. When this condition becomes worse, the person will have shortness of breath at the time of rest or asleep. Experiencing breathlessness after a run or a walk or climb or intense exercise is normal. But breathlessness during resting could be a symptom of heart disease. This sign of heart disease makes one feel exhausted and tired. It is important to look in this condition because breathing and pumping of blood in one's body are very closely related. Fifth, unusual tiredness. Sometimes the heart is not capable of pumping enough blood to meet the body's requirements, so blood is diverted from less important areas like arms and legs to the vital area like brain. This is why people with heart failure feel tired and find it difficult to do simple activities like climbing stairs or carrying things. This is more commonly found in women. Again, tiredness is a non-specific symptom and could be because of other health issues too. So, if one also has other signs of heart disease, it is better to take medical opinion to find out for sure. 6. Indigestion. You see, older people usually have weak digestive system. They may also frequently have indigestion or heartburn. But this is also a sign of heart issues or heart attack. Generally, heartburn starts at the upper belly and it moves up. But in the heart problem, the pressure is felt in the chest and it moves to other parts. It is also accompanied by lack of appetite or nausea. It is best to pay more attention at the digestive level to the digestive problem, especially in an old people, to find out that is it due to any heart related issues. 7. Sweating. If a person is resting and sweats more than usual, these could be warning signs of heart problems. Sweating more than usual happens because of exertion. Here, your heart has to work harder to pump blood to clogged arteries. In women, night sweats are more common. Sometimes, in this condition, the bedsheet also gets soaked with sweat. It is best to get experts' advice if one is sweating excessively while the body is at rest. So, we have looked at these 7 signs which can tell if one's heart needs help. Now, you may ask, how can I know whether my heart is functioning well or not? For that, you need to take what is called as electrocardiogram or ECG test. This painless test, which takes about 5 to 10 minutes, finds out if there are any problems with the rhythm or rate of your heart. You see, heart diseases sometimes become worse without giving any major signs. Hence, you have to monitor the minor signs that we have looked at so that one can get early, timely treatment. As much as it is important to have a medical checkups, it is important to have a healthy lifestyle. Reduce the salt and saturated fat in your diet. Try to get enough sleep. Maintain a healthy weight and exercise at least for 30 to 40 minutes every day. This will definitely improve your heart health and enhance the quality of your life. Namaskar.